Good afternoon and welcome back one more time. It's if you're just joining us, I'm Keith Friedenberg, Chief Operating and Innovation Officer at CHIME, and it's my absolute pleasure to welcome you to the CHIME Innovation Virtual Summit. This is our last session of the day, and it's my absolute pleasure to introduce our closing keynote speaker, Dr. Zafar Chaudry, who is Chief Digital and Chief AI and Information Officer at Seattle Children's. And I should also add an incoming member of the CHIME Board of Trustees. Dr. Chaudry is here today to share some strategies that he's using to foster a culture of adaptability and innovation at Seattle Children's. Before I turn things over to my friend, I'd like to note that he is also a faculty member and host for the upcoming CHIME Innovation Summit, Moonshots in Digital Health Innovation. That'll be hosted on the campus of Seattle Children's next May 14th through 16th, and we're pretty doggone excited about that. This program is going to delve into some groundbreaking advancements in AI and ML. We'll talk about advanced health analytics, precision medicine, personalized healthcare. You name it, we're going to explore it if it's hot and innovative in health IT. So mark your calendars for that. We'll talk a little bit more about that at the end of the session. But Zafar, my friend, welcome, and thank you for joining us to close out the virtual summit today.
Good afternoon, everyone. Thank you, Keith. Thanks for having me. It's always a pleasure to join. Good afternoon, everyone. It's an honor to be here. So yeah, today I'm talking about workforce adaptability and innovation in healthcare. So imagine you're a healthcare hero armed with the latest medical tools and unwavering compassion. But there's a new villain lurking in the shadows, and that's called rapid change. To defeat this foe, we need a secret weapon. And what we need is to make sure that our workforce is adaptable and is focusing on innovation. So in today's rapidly evolving healthcare landscape, next slide, please, the ability to adapt and innovate is no longer a luxury. It's a necessity. As we sort of look at healthcare professionals, we're constantly faced with new challenges and opportunities. To successfully navigate this complex environment, it's imperative that we cultivate a culture of adaptability and innovation within our workforce. And here at Seattle Children's, we sort of started this journey by setting up a series of guiding principles. Those guiding principles are based around our digital fundamentals. If you can just scroll through the slide deck. So first thing we wanted to do was figure out, well, how are we actually going to do this work in collaboration with what we classify our customers, our clinical teams, our non-clinical teams, and of course, our patients, parents, and caregivers. So we like to keep it simple. We want to be very patient-centric. So one of the first things we did around this was to say, it's really important to have the voice of the people that we're serving. So we have set up as part of our innovation arm is to have a monthly patient, parent, and caregiver meeting. So me and my team, we meet with our customers and we discuss what's happening in the world, what do patients need, what should we build, what should we look at in terms of innovation, because we're hugely wanting to be patient-centric, but at the same time being able to co-design anything we come up with in the future. Also around that, we want to make sure that our digital leaders in my team are always working in partnership whenever they come up with what I like to call harebrained ideas around how we can improve an experience. And at the same time, we've gone through this journey of we can't keep buying more tools and having more systems to support. So we have to make sure that the systems we have are core systems that we can work through. We want to make sure that any work we do meets some sort of industry standard. And we definitely want to make sure that as we are doing this, we're not missing out on some of the important things, which is how do we make sure that our workforce has the digital skills, and how do we make sure that our parents and patients also have access to the digital tools? Because we see here in the state of Washington, equity issues around access to internet, access to handheld devices, access to laptops. That actually varies between Eastern and Western Washington. So we want to consider all of these guiding principles when I was thinking, well, how do you unleash people, unshackle the chain so they can actually innovate and move forwards? Next slide, please. So what we're sort of seeing is this rapidly evolving healthcare landscape and lots of technology. You know, I always think the most interesting thing I've found in the last 6 months is, you know, everybody that you talk to is an AI company. For example, there must be thousands of healthcare AI companies now who all think they can solve your problems, but don't necessarily know what problem they are trying to solve or what the exam question actually is. At the same time, I've had to coach my team through this model of we used to be very process oriented, but we need to start becoming more agile and adaptable in the way we build solutions at a pace. So the key being it's okay to build something, it's okay to fail fast, because that's how you're going to learn new things and at the same time help with the potential to revolutionize patient care. But in order to do that, we also have to think about what is the mindset that we have as a team. And at Children's, we've worked hard to get my team to a point where their mindset is more of a continuous learning environment than ever before. Build something, doesn't work, it breaks, move on to something else, get feedback, co-design, and then come up with something that actually, you know, at the end of the day, we want to make sure that we treat kids the best we can. We want to make sure that people choose us as a provider of first choice for their care, for their children's care, and therefore be very innovative and have a competitive advantage in this space. So next slide, please. So what's the steps? Step one was to talk to people in the team about changing the mindset. Step two was engaging all of the co-folks, customers, patients, parents into how do we design new cool things. And then fostering this culture of continuous learning is focused around, firstly, education. So we've done a huge amount of work to take a look at how my teams can be educated. But in parallel, we've gone out to the community. So one of our most interesting innovations of late is partnering with community organizations and focused on the fact that those community organizations can help us develop the next generation of individuals and technology pipelines in our organization. So the way in which we've done that is we've partnered with the City Colleges of Seattle, and we've worked with them to say, we actually have to build a pipeline of the next generation of IT employees and leaders, and how can we do that? And we've built, in collaboration, a scholarship program where we wrote the associate's degree in health information technology in partnership with them, got that state approved, and then had the ability to sponsor 10 high school graduates every quarter to get that education. And how that's helped my team innovate is that my leadership team actually teaches on that program. So they get the ability to take their knowledge and put that knowledge to good use around clinical systems, around some of the digital tools that we build, and at the same time, see the next generation of kiddos grow into possibly our organization or neighboring organizations. The other parallel to our continuous learning is building a whole series of mentorship program. So we focused on pairing experienced employees with newcomers so that we can facilitate knowledge sharing and career development. So that's certainly really important because we obviously, people like me will age out, and I have to make sure that there are people to take my place. So mentorship is really important, but mentorship at all levels, from the front line to mid-range management, all the way to top level management. And then what we've done in our organization is think about building learning communities where employees can collaborate, share ideas, learn from each other. So we have built within our team an employee welfare group. Their goal is to share knowledge, but also take care of the holistic IT employee. And the tools, the digital tools we used are simple tools that everybody in this industry uses. We're a Microsoft shop, so we're using Microsoft Teams and all the tools within Microsoft portfolio to collaborate, communicate, share best practice. And then at the highest level, we said we also need to develop the next generation of leaders from within our organization, because succession planning will allow us to be able to do this and continue that charge towards being adaptable and being innovative. So we have invested in developing leadership programs so that we can inspire teams and empower teams. And we've also highly encouraged people in certain teams to cross-train in other teams, because I think people that are stuck in the same vertical, and I have 35 vertical teams at Seattle Children's, need to learn about other teams and parachute into other roles. So we do frequently change roles and responsibilities and encourage teammates to learn from other teams and work in other teams, even on a sort of mini sabbatical process. Next slide, please. So some of the other things that we've worked about is how did we allow teams to then do things which were thinking outside the box. So we assigned some funding, what I like to call fun money or research and development money, and we assigned some of that to teams to say, if you have a great idea, there is some funding for you to test those ideas. So I'll take you through a journey. I was sitting in a patient advisory group probably about 2 years ago, and I was sitting with them, and there's some good 12, 13-year-old participants in that advisory group. And one of these kids jumped up and said, you say you lead the IT team, but you don't know very much about IT. And I thought, well, that's an interesting comment. And I said, well, please tell me more. And I've sort of learned in this journey that the average 12-year-old probably knows more than most CIOs. And I said, well, tell me more about why I don't know a lot about IT. And he said, well, if you truly understood the problem we have, we're kids, we get treated at your hospital, some of us have to stay here for a really long time. Do you know that it's very boring to be in the hospital and be sick? Do you know that there's nothing to do in your hospital to keep us engaged? Did you know any of that? And I said, well, I don't know. So tell me what it would take to engage you and your friends and anybody you know of your age. And he said, well, I think what you need to think about is an immersive gaming environment in our organization, because that's really important. And I said, oh, that's a really good idea. So I came back to the team and I said, look, we've got money to test new things. I've been told I don't know much about this space, and I've been told that gaming is a very important thing for the average 12-year-old. Is there something we can do in this space? So when we looked at how did we transform that experience, well, we're the first in the world to launch Minecraft. Our entire hospital is built in Minecraft, and we have our own Minecraft server to protect kids from external entities. And the team decided to go down the path of building that into that particular server, and then launch that in collaboration with the same folks that wanted to know about how we can innovate in this space and how we can bring gaming therapy to them. And we were able to do that. It took us about 2 years to launch that. We launched that about 6 to 8 weeks ago. But that was multiple teams coming together on the basis of hearing a challenge and then rising to that challenge, but being allowed to make decisions. I then didn't have any further input into that. The teams ran with that. There was funding provided to them. And what we learned in that process is when we launched this on Twitch TV about 8 weeks ago, and we had testimonials from some of the patients who had helped us test the environment, what we learned is technology truly has the power to transform healthcare, but it's essential to use it wisely and collaborate with the people that you're actually impacting with it. And we learned that gaming therapy truly helps kids heal when they're in huge amounts of pain. And that was just one example of taking a program, transforming it, and then moving that forwards. The other thing that we looked at in the innovation space, and you should consider, is, well, we're all sitting on bucket loads of data, and data allows us to make good decisions if we actually do something with it. So one of our other projects was around data, and that also stemmed from one of the problems we see here in Washington State with kids, which is a high use of opioids, a high addiction to opioids, and a crisis around that. And we sort of looked at this and said, yeah, this is a major problem in Washington. We were seeing a lot of kids with mental health issues. We were seeing a lot of kids with suicide. Attempted suicide is the major problem in the state of Washington amongst teens. And that was due to some opioid addiction. So we worked with our clinicians to say, well, what can we do around this space? We're sitting on a whole bunch of data. And once again, we spun up another group. I like to call these task and finish groups in my organization, because we sort of hone in on a task. We assign some people who actually volunteer to do these cool things. And then we call it a finish group because it always has a finite end date. We challenge ourselves to put something up, get it working, and then close that down so we can move on to the next innovation. And we do that. In this particular case, we used data to drive decision making. And we looked at all our analytics. We have 117 different clinical systems feeding into our Google platform, which is what we use for our analytics. And we were able to use the power of AI as well as clinical help, because we had to co-design this with our clinicians. And we focused in on the area of surgery. So in surgery, kids are given opioids to put them to sleep, and then they're usually given opioids after they leave the hospital for pain management. And using the data that we had, we figured out that we could use alternatives to opioids to put them to sleep and alternatives for pain management post-discharge. And working through this, what we've achieved is over 61,000 surgeries without the use of opioids or the prescription of opioids post-discharge. So that was another way in which our team tasked and finished and came up with a data-driven decision-making process. The other thing is hackathons. I'm sure you all do them. We try to do 2 hackathons a year where we get teams of clinicians, IT people, analytics people, digital health people together, usually for 2 days, 2 full days locked in the room. The clinicians bring us a problem, and then the teams that are formed get around that problem. And at the end of that 2-day period, they're presenting the solution to the problem that they were tackling. And then there's a vote, people win a prize, so we make it competitive, and we fund that work as well. And if you organize events, what you end up doing is encouraging creative problem solving and generating innovative ideas, which is really important. Pilots are really interesting in healthcare. I'm sure you'll agree that if you've ever ran a pilot, usually pilots don't seem to end if they're successful. So small-scale pilots are good to test new approaches, and you can learn from the failures. The caveat would be never start a pilot and then it becomes a full-scale project, because then you're going to have problems managing the change. And that's something I have seen. So we try to keep our pilots very succinct to a very small statement of work. And when we proved it, we try to spin the pilot down or operationalize it if it truly is successful. Next slide, please. So some of the things to think about when you're working in adapting your organization and building a new culture where people try to think outside that box is the first thing to sort of think about is you've got to create that positive, supportive environment. You've got to give people some fun time for them to work on these things. Because if you empower your employees to make decisions and be creative and take risks without repercussion, you see some amazing stuff coming out. As long as they know they're not going to be told off for something that didn't work, they'll really want to tell you what they can do. And the subject matter expertise is there. People have hundreds of people in their IT teams and so many smart people with so many adaptable and innovative ideas. You've got to build an environment where the people feel psychologically safe to take those risks in an experiment. And so we've been very clear to say, when you're working on these teams, if you build it, it's great. If it works, amazing. If it doesn't work, we'll scrub it and start again. You've got to give the employees the budget and the time allocation to do it. So i.e., you are empowering them to make decisions and solve them. So I tend not to get involved in those. They do their own thing and then show me the outcome versus me being seen as the person poking my finger into what they're trying to achieve. And like I said, you've got to give people adaptable work arrangements so they can absolutely do this piece. Lights on, doors open work does wear people out. So bringing in the ability to have an hour or two a week to put into something that they think is going to make a difference is always a great idea. And actually, when we do things that don't work, we actually celebrate those failures. We love whiteboarding sessions here. When something fails, that's when I do get involved because I love to whiteboard. I'm a really bad scribe and I'm a really bad person at drawing. I'm a physician, so that kind of explains why. But I do like scribbling on a board, learning what went well, what didn't go well, what we can use to adapt to the next environment that we have. And I think that that's really important. So here's some steps you might want to consider because we've tried them and they do work. Lots of communication underpins all of this new culture that you might want to focus in on. Next slide, please. There are things to think about, though. This is still a change program. If you're going from a very much lights on, doors open environment, which is where we were, yes, we do tickets, yes, we fix devices, yes, we fix applications, to creating a more adaptable and innovative healthcare workforce, we've got to address a few challenges. So one of the challenges that you come up with is there is resistance to change. That I saw in my team over the years of this journey, some fears and misconceptions. Well, isn't this going to change my job? How am I going to fit that in? What does this mean? Is it in my job description? What do you mean I have to work with clinical staff? Because in IT, we have a lot of introverted people, including myself, and therefore not everybody wants to go to the front line and engage and have conversations and build new things. The other thing that we've always seen, and I work in pediatrics, so it's very common, there are resource constraints, right? So we have to optimize the resources that we have. Sometimes we have to seek partnerships. Sometimes there's research funding, because luckily we are a research institute as well, because sometimes I don't always have the money to throw at something new, especially if I may lose that money because we failed at it. Anything we build has to be compliant, follow all the regulations, not violate any data security protocols as such. So when trying to build an innovative environment in your team, you've got to be very clear as to what the goals are of the program, how you're going to monitor those programs, what flexibility you're going to give your teams, how are you going to allow your teams the time to do this. But you shouldn't do it unless you've done a current state assessment of where you are, because there's a level of maturity in every team. When I started this journey, I've been at Seattle Children's for 7 years. When we started this journey, we were not mature enough to do innovation or think outside the box because we're really firefighting. We were trying to fix broken networks and infrastructure and sort out uptime and deal with complaints about laptops. I'm sure you've all been there. So it took us a couple of years to stabilize and be able to do the lights on, doors open work well. And then that took us about 2 years. And then we got into this space of what are the cool things we can do that will have an impact. And people are now bringing more and more innovative things to the table. I've described some. There's some AI stuff that we're working on now that is around language translation, because we give discharge instructions in English and Spanish, but we found that many of our patients and parents and caregivers speak Somali, they speak Ukrainian, and their discharge instructions in English don't necessarily gel or make sense, which then has an impact on post care for the child, which may result in readmission. So we're sort of looking at that and how AI can help with that as another example. Next slide, please. So as you sort of think about this, don't forget there will be a resistance to change. Change management is a long journey. There are always resource constraints. And most importantly, we're not the best in healthcare of integrating technologies. So if you buy a whole set of new technologies or bring a set of new technologies into your environment as part of your innovation program, you need to make sure that they are sustainable technologies, and those technologies can integrate with the tools that you have. Otherwise, you're going to end up with application sprawl, too many applications to manage, and it goes against our guiding principles of let's try and keep it simple. So we always start with, do we already have a tool that can do what we're thinking about doing? If not, then we would consider something else versus immediately jumping to the next shiny toy. Because of course, we all suffer from shiny toy syndrome. You see it in a conference, you want to have it. You don't know if it's actually going to be sustainable though, and will it be affordable? And what will that total cost of ownership look like? So do think about picking technologies that integrate, that can sustain. And yes, I truly believe that with 2,000 plus AI vendors in the market popping up, they won't all be here 3 years from now. We've seen this in the pandemic with all the investment in digital and how many people are still standing. So you have to be very careful in that space. Next slide, please. So sort of as I wrap this up, by fostering a culture of continuous learning, embracing technology and innovation, making sure that you are building an environment around yourself and around your teams that allow them flexibility and adaptability so that they can try new things, they can fail fast, they can unlock the full potential that you know and I know that we have in our teams that we don't truly tap. But when you do tap, it blows your socks off. By allowing our employees to be empowered to make decisions, giving them some funding that if you lost, it wouldn't break the bank, allows them to critically think of things in different ways, making sure that they're partnering with the front line allows them also to solve real world problems whilst embracing the change of engagement, because IT folks don't always like to engage. This way you can ensure your healthcare organization, I can ensure my healthcare organization is well positioned to meet the challenges of the future. And what I would love for everybody to commit to is creating a workforce that's not only adaptable, but is flexible, because we have to drive positive change. If we don't, who will? And if we do it, then this will absolutely improve the lives of patients. As I said, our simple gaming program has changed the lives of many kids who've come to me and said, I wouldn't have made it through my treatment if you hadn't built this gaming environment. And that tells me that certainly at Children's, we are tracking in the right way. But remember, it's always about the patient. I always tell my team, we are not in the IT business. We are in the patient business. And as long as we remember that, we will always build solutions and tools that make that the top priority. So I thank you for listening. Thanks for spending a few moments with me. It's been a pleasure to be here.
Thank
Over
you,
to you.
Zafar. I got to tell you, I'm so inspired by some of the examples that you shared, whether it's the immersive gaming environment that's helping kids heal faster and reducing pain, to over 61,000 surgeries with no opioid prescriptions. I mean, this is really innovative and creative stuff. If you'll entertain a quick question, I just want to circle back to something that you shared that I think is so important here in terms of the continuous learning environment that you've been able to create at Seattle Children's. When you arrived there 7 years ago, you talked about how important it was to really allow your teams to fail, to learn from that. But you went further. You said you celebrate the failure. And when you tried to instill that in this continuous learning culture, did you face initial resistance? Was your team like, yeah, this feels like a trap? What was that like when you started to
Yeah,
implement that?
so, people actually thought that somehow I'm going to put them in trouble
Yeah.
and I'm going to catch them out, right? Because trust is a thing. And as a new leader in an organization trying to change a culture, you are the individual who is the least trusted. And trust is earned, right? So one
Yeah.
of the things I learned is it doesn't really matter what I said in the beginning. Nobody believed a word that I said. It was through actions
Yeah.
and probably the first couple of failures that they realized, oh, we did fail and I still got to keep my job. But yes, they absolutely had to come to those lessons
Yeah.
learned sessions,
Yeah.
which, when you have to self reflect on what you think you did well and what you think you didn't do well, that's always hard too, right? I mean, self reflection is also part of this journey. Every single one of us, we get so wound into doing the same thing every day. Even I sometimes struggle with that because, today's a Wednesday and I'm like, well, today's not my normal Wednesday because I'm doing this innovation summit and it feels different, right? And I now have to tell someone about things that we've been doing. And as you sort of think through, it doesn't register till you talk through, well, we've done these things and we've done these things. And I mean, I could give you a list of all the things we've done terribly in this process, starting with our initial innovation of not engaging people.
Yes.
At first, we thought we're IT, we know best. So let's build something and people will just come. And then they didn't come and they're like, well, what happened? And I said, well, probably because we didn't ask anybody. and and so that was a hard lesson, a hard pill to
Yes.
swallow, as they say, very early in the journey. But now they do engage, even some of them reluctantly still. It's very hard to go and have a conversation. It's harder to have a conversation with a parent who is taking care of a very sick child and you want 10 minutes of their time, right? They probably don't
Yep.
have that time. But funnily enough, people respond if you're trying to help them with something that will work for their child.
Zafar, we're unfortunately out of time. I would love to spend another hour with you if I could, but I also know it's late for you in the UK. Let me again thank you for an amazing closing keynote. I'm super inspired. Dr. Zafar Chaudry, everybody, Chief Digital Officer and Chief AI and Information Officer at Seattle Children's. This was a lot of fun, and I know there's so much more for us to dive into. And I'm looking forward to joining you on the campus of Seattle Children's in the spring. In May, we'll talk a little bit more about that in a minute. But thank you, Zafar. Appreciate you, your time and your leadership and everything you do every day to improve health and care. So appreciate
Thanks,
that.
Keith.
With that, we'll take a few minutes. We'll just wrap things up here. The Innovation Summit would not have been possible today without the support of our sponsor, Profit Advisory Group. Really want to thank Ken and the entire PAG team for their generous support. of the Innovation Summit. I have mentioned that we have an amazing slate of in-person innovation summits coming in 2025. We've significantly expanded the offerings for next year, really based on the desire and demand to continue to identify and spotlight amazing innovations out there. So I'm not going to read this list of amazing innovation summits planned for next year, but hit that QR code down below. Start the process of registering. You can come to one, you can come to all five if you'd like to travel around the country with us as we look at some of the big innovations that are really driving impact and really impacting care out there in 2025. I will tell you that the last two innovation summits that we held earlier this year sold out. So go ahead and hit that QR code, get your spot today. We'd love to see you in a future program. And if you haven't already done so, now is the time to mark your calendars for Vive 2025, taking place in February 16th or 19th in Nashville, Tennessee. Nashville is fast becoming the new digital hub for digital health innovation. We know technology is evolving at an incredibly rapid pace. You got to keep up with these changes. It's important to also connect with your peers, stay up to date on what's happening in innovation. Develop and maintain those critical leadership skills, and find inspiration from others that both inspire you and inspire your team and your organization. You'll find all of this and so much more at Vive. Vive literally is the event that was designed around digital health leaders. It's literally by you and for you. Registration is open now. And if you are a leader or a decision maker at a provider organization, there are actually two ways for you to secure a free pass to Vive. That's one of those is through the CHIME Ambassador Program. The other is through Provider Connect programs at Vive. Again, we know times are tough. Financial pressures are real. So hit that QR code on the screen. It will tell you a lot more about how you and your team can attend Vive at little to no out-of-pocket cost. Great opportunity for you if you want to attend Vive and bring your team members with you. With that, a lot of thank yous. To wrap things up here, I want to thank everyone for joining us today. A special and heartfelt thank you to our opening keynote speaker, Terry Couts, our amazing panelists, Emily Warr, Melissa Giampietri, Colin Turk, Ken Rita, Linda Stevenson, and Scott McLean, our moderator extraordinaire, Rebecca Woods, and our closing keynote speaker, Dr. Zafar Chaudry. Thank you all for joining us today and adding so much to the conversation. Keep doing the hard work that you're doing every day to really take care of your workforce and build that thriving and resilient workforce. We need you all, and we need your teams. Huge thanks to our production engineer behind the scenes who made all of this look so seamless, Luke Skaggs. Thank you, Luke, for the amazing job you did. And I have to acknowledge Chris Worth. I know she's going to hate this, but Chris does also so much behind the scenes to make everything like this work. Thank you, Chris, for your amazing support. Thank you, everybody, for participating. Happy holidays to all, and we hope to see you at a future CHIME Innovation program very soon.